Hey, welcome back again. This is Dr. Lachlan. Welcome to my YouTube channel. I want to go ahead and share with you another case. As you can see, this case patient go from lower teeth uh, crowded to a beautiful smile. Let's see how we can help you guys to improve your journey as well. Without further ado, let's jump right in. Okay, here we go. So the initial step of the patient case is this is where you take photo occlusal view upper arch minor crowded. Number 8 and 9 are not quite straight, little narrow arch on the upper. As you can see, number 8 is a little bit longer than number 9. In wearing, there's an area of wearing usually come from lower tip, more intruded or extruded out. So you can see that there the damage of number 26 to 23. This comes from the deep bite. So this is the patient about 23, 24 years old. If you don't recommend bracing with braces, what's going to happen is the next 10 years, those teeth going to get very short. Patient will have sensitivity and will have a very irregular smile with the canine, everything get damaged. So it's important to identify the patient problem and really take care of the patient. So that is the diagnosis that we have to diagnose it to how we're going to improve this case. So the improvement, the goal of this case is to not only provide the lower arch bigger, compensate for the deep bite, correct the deep bite, allow the patient to have better airway space, so patient can breathe better, sleep better at nighttime. That's the goal. So again, this is the another picture when the patient open the teeth, lower teeth is open slightly, as you can see, crowded, and the damage of the incisor right there, pretty bad. If the general dentist, if you don't really look at these, you're gonna have a problem. You're not helping the patient, but no matter what you treat, like deep cleaning every couple of years doesn't do any good. The gum not going to get better because teeth is so crowded. Very difficult for the patient to maintain good hygiene. Um, Upper look great, right? But you can see there's a damage there. That's why you have to be able to know, understand what is your patient need. So wearing, as you can see, I take a closer shot. The very sharp in enamel being wear off, worn off. Um, on number 23, 24, 25, especially. The 26 is incisively rotate in, that's why you don't see it. But there's the evidence of the canine damage on number 27 and 22, really damaging. Um, so we start with braces. The goal is to open up all those teeth crowded and with open coil, correct them. Um, Although with literature, wire, very simple, it's not that complicated. Um, it takes time. You got to be patient with your patient because if you are doing with orthodontist dentistry, if you rush, you're gonna end up having a hard time because orthodontist is one day at a time, 1 week at a time. So you can see there's an improvement slowly. I'm able to open the space here and slowly using a different kind of force. You can see like how I put the the power chain and pull the tube out from the lingual to the forward. It takes time. Don't rush yourself. Use a lot of adjustment. You can see that again, there's the improvement from here to here. and the bottom at the top is pretty significant improvement because not very minor correction, but the bottom you can see how much improvement we're able to from how it is the lower incisor were lingually inclined. Now you can see facially inclined, a big difference. This is how you can correct the deep bite. Okay, so you can see the improvement as we go from deep bite, like almost like 80%, 90% now. Be able to correct to almost like 40, uh, reduce 40% deep bite, and see now the patient can, once he smile, you can see the lower teeth, very significant. Sort of the picture on the top is from start from above and it just go down and you can evaluate. How do you know your case is complete? That's a dentist question, right? If you are a general dentist, how do you know when your case is looking good? See, you see the line from the top and here, when they're not parallel, that indicate that the two arcs are not together yet. So it takes time. When the teeth straight, you can see that the two wire completely parallel to each other. That's where you know that your case is getting better. Also, it depends on where you place the brackets. But my bracket, the way is when I see the parallelism of occlusive or upper and lower equally aligned, that indicate that the teeth are getting really straight. So the next step that will be, you're using the thickest wire to maximum the torch of the root to create the upright of the front teeth to create stability. So just more picture that you can see, show you what it looked like from here, looking at how we pull the tooth out from number 26 lingually out. It takes time, guys. You can't rush yourself. A lot of patience to do this. Now patient look wonderfully improved. Patient was happy that things getting better. Look at the result of smile. From here, deep eye to here. Look at the smile from here to here. From lower teeth crowded to straight teeth. Plaque buildup is the result of not cleaning the patient do not a good job for hygiene. But it's amazing the difference here, and you can see it's beautifully improved. She's super happy, super happy, super happy with the result. That's what you want to get done for your patient. Let's see. Let's see anything that I can touch on. Yeah, the bottom teeth, you see at the beginning the patient cannot smile. This is a very fake smile. Doesn't smile right. But this you can see that the patient really know how to smile. Orthodontics not only improve confidence for patient. I want to do this to you guys, I want to explain to you guys this. So orthodontics not only improve confidence for your patient, okay? Orthodontics not only improve confidence for patient, psychological improvement, aesthetically improvement, airway space improvement, all in one. Very important to get your teeth straight. Have any question, let me know. Thank you for watching. Have a great day. Bye-bye.